Welcome to Anatomy. FMGE, NEET, Next 2024. PG Exclusive Test Series. Today's MCQ from Abdomen, and the question is: with one exception, the following statements about the supra-renal cortex are all true. And the options are: A. Derivative of mesoderm. B. Secretes corticosteroids. C. Secretes androgens. D. Associated with sympathetic nervous system. E. Causes the kidney to retain sodium. Before going to the correct option, let us discuss some features of the supra-renal, or adrenal gland. Supra-renal glands are endocrine glands, situated in the posterior abdominal wall and retroperitoneal. Each supra-renal gland is situated on the superior pole of the corresponding kidney. Like kidneys, each supra-renal gland is also divided into the outer cortex and inner medulla. The outer cortex is further divided from outside to inside are: 1. Zona glomerulosa, that secretes mineralocorticoids like aldosterone and corticosterone. 2. Zona fasciculata, which secretes glucocorticoids like cortisol and cortisone. 3. Zona reticularis secretes androgen like dehydroepiandrosterone or DHEA, which stimulates the testes or ovaries to produce testosterone and estrogens respectively. The suprarenal medulla consists of a special type of cells called chromaffin or sympathetic ganglionic cells that secrete catecholamines, which includes epinephrine or adrenaline and norepinephrine or noradrenaline and dopamine. In addition, the medulla also secretes small amounts of somatostatin and substance P. Coming to the option A, derivative of mesoderm. The suprarenal gland has a dual embryological origin. The cortex arises from the coelomic mesoderm of the urogenital ridge, and medulla arises from neural crest cells. During 4th to 5th week of fetal development, an embryological structure, the urogenital ridges or urogenital folds, arises from intermediate mesoderm in the lumbar region of the embryo. The urogenital ridge differentiates into two structures. 1. Adrenogonadal primordium gives rise to primarily reproductive system and adrenal cortex. 2. Nephrogenic cord gives rise to primarily urinary system. The adrenogonadal primordium divides into fetal adrenal cortex and bipotential gonad, later gives rise to testis or ovary. Meantime, the neural crest cells of trunk region migrate into the center of the adrenal gland's cortex and develop into the chromaffin cells of adrenal medulla. These medullary cells are essentially postganglionic sympathetic neurons that releases the epinephrine and norepinephrine into the bloodstream. Now coming to the explanation for the option B, that is, secretes corticosteroids. Mineralocorticoids and glucocorticoids are corticosteroid hormones, classically thought to be secreted exclusively by the adrenal glands. The mineralocorticoids of zona glomerulosa are class of corticosteroids, produced by the adrenal cortex, which influences the salt and water balance, or electrolyte and fluid balance. The primary mineralocorticoid is aldosterone and corticosterone. The glucocorticoids, or glucocorticosteroids, are produced by the zona fasciculata of adrenal cortex that secretes the hormones like cortisol and cortisone. The fact that it is called glucocorticoids suggests it is involved in glucose metabolism. During fasting, the glucocorticoids serve to increase and maintain normal concentrations of glucose in the blood. In addition, it also plays a role in the development of homeostasis of T lymphocytes. The sex hormones dehydroepiandrosterone or DHEA and androstenedione are secreted from the cells of zona reticulata, which is the innermost layer of adrenal cortex and close to the adrenal medulla. These hormones are released into the bloodstream and taken up by either testis or ovary to secrete testosterone or estrogens respectively. Now coming to the option C, secretes androgens. Just now it was discussed that androgens are secreted by the zona reticulata of adrenal cortex. The option D, stating that, associated with sympathetic nervous system. The adrenal medulla is actually a glandular extension of the sympathetic division of the autonomic nervous system. Just now, we talked about how the suprarenal medulla grows, which happens when neural crest cells from the trunk move into the center of the adrenal gland. When stress, or a danger turns on the sympathetic division, the medulla sends two catecholamines, epinephrine and norepinephrine, into the bloodstream. Both of them have the same effect on the areas they are meant to affect, but epinephrine stays in the blood longer and has a stronger effect. Hormones from the adrenal medulla make the heart beat faster, narrow the blood vessels, to raise blood pressure, and speed up the metabolism, to make more energy. The fifth, option E mentioning, causes the kidney to retain sodium. For retaining the sodium, the secretion of aldosterone is essential, that it is secreted from zona glomerulosa of adrenal cortex. The main purpose of aldosterone is to work on the distal convoluted tubules and collecting ducts of nephrons in the kidney. This stimulates sodium and water reabsorption and potassium excretion, and it helps to keep the acid-base balance in check. Before going to the correct answer, let us modify the question for our convenience is: all of the given statements or options about the suprarenal cortex are true, except yes, your judgment is correct. For the given MCQ, the option is D, associated with sympathetic nervous system. Because this option is related to suprarenal medulla, subscribe, leave a comment, give it a like, and share if you enjoyed it.